Okay, today we are going to be inserting an indwelling catheter into a female patient. I have checked the doctor's order. We have our catheter kit in the correct size for the patient. We have our water basin filled with water and cleanser, and we have our towels for perineal care. And we are going to go on in. Ready? Hi there, my name is Chelsea. I'm going to be your nurse today. We're going to be inserting a catheter to help with that urine retention, relieve some pain and discomfort. I am just going to take an antiseptic wipe down my work area, wait for it to dry. It's dry. I'm going to place my water basin here, towels, and my sealed catheter kit there. Before I get started, I'm just going to perform hand hygiene. Right. Okay, and can I confirm your name and date of birth? Wonderful. Do you have any allergies? No allergies? Great. I am just going to go over to my computer, confirm that he has no allergies, confirm we have the correct patient, and I'm going to confirm the size of the catheter that we're using, and all checks in, we're good to go. Now I am going to don some gloves and just a little more hand hygiene. Don some gloves. We're going to palpate that distended bladder, and we are going to assess before we do a little perineal care. All right. Would you like to do any of your perineal care yourself? No? Okay, I'll do it. Not a problem. So we're just going to take this blanket and pull it up a bit, so just so that we can see the perineal area and assess that bladder. All right. Yeah, definitely full. Needs to be relieved. I'm just going to put your legs up in a dorsal recumbent position. Okay, I don't see any lesions or anything that would inhibit us from doing perineal care, so we're going to continue on. I'm going to take this towel and we're going to lay it underneath the patient's perineal area, just so we don't get any water on that bed. Keep this area clean. Okay, stretch it out. Okay, so I am going to take a washcloth. I'm going to begin perineal care. Put it in the water, warm water with cleanser. Bring it out a little bit. Take a nice clean side. We're going to start with the inner thigh. Wipe that down. Take a clean side. Wipe that inner thigh off. So nice clean water. Then we are going to put this to the side. I am then going to take a bigger towel and just pat this area dry. I'll then take a brand new washcloth, soak it in some water, wring it out, and we're going to start with the perineal care. So we're going to go from the outer labia first, one sweep, get a new side, do one sweep on the outer meatus of the labia, go down. Now we're going to cleanse the inner labias, one sweep, we're going to do that last side. We are all clean. Put this in my basin and put my basin to the side. No longer needed. Now I am going to take off these gloves. And I am going to remove this bath blanket in the basin. I'm going to perform a little hand hygiene. Put some new gloves on. Clean gloves. All right. Now that we have completed perineal care, we are going to start taking the steps to insert that catheter. I'm going to make sure that my table is at a working level. It is. It's great. I am going to check my catheter kit is not expired. It's not. The size is exactly what it should be, a 14 French. And I am going to ensure that this is not a catheter kit where I need to inflate the balloon beforehand. It's not, so we won't do that step. Now I'm going to remove it from its plastic covering, place it on my clean working field. Actually, I'll place it this way. Okay, now we are going to work to maintain sterility. To the side. Going to open it away from myself. Okay, great. And I'm just going to adjust it, maintaining sterility. Alright, now with my clean gloves on, I'm going to maintain sterility and take this sterile drape, opening it up. We are going to put it glossy side down under the patient. I'm going to take that outer edge, again maintaining sterility. Oh my goodness. And we are just going to pretend that this is not too big for the patient, because it is a little too big for what's going on here. Okay, and we are good. Okay, now I'm going to remove my clean gloves. Again, perform some hand hygiene, because we are going to be donning sterile gloves. All right. Okay, and I'm going to remove my sterile gloves from the kit, maintaining sterility. So I'm going to now don my gloves. Having a little issue. One finger wants to go in the other. Non-intended hole. Okay, maintaining sterility, we got this glove on. Now we are going to cuff our other glove. Okay, now, because we are sterile, I'm just going to adjust this. Pinching the inside, again maintaining sterility. Pushing that down, adjusting the glove. Okay, and we will pinch the inside, dispose. Now that we have sterile gloves on, we will take our fenestrated drape, place it over the genitals of the patient, exposing the genitals. Okay. Now I am going to take the tip of my catheter. I'm going to open up the lube, insert it in, twist it around, get it lubed up about 2 to 4 inches. Okay, so now we have that lubed up, good to go. I'm going to take my syringe, attach it to the port of the catheter. So we are all set. We won't break sterility once we start inserting this. Okay, now, in real life this would not attach, because in real life they click on. And we will take this and transfer it over to our sterile field in the bed with the patient. Okay, now we are looped up. Good to go. I have my alcohol swabs here. I would rip these open, and I would do one swipe down the labia, discard, one swipe down the other labia, and one swipe right down the middle. and these are all trashed. Now, this would connect. Now we are going to take our lubed up catheter and we are going to, actually, I'm going to take this hand, I'm breaking sterility, maintaining sterility with this hand, and I'm going to open up the meatus of the vagina, and we're going to start inserting the catheter into the urethral meatus. Okay. And we are going to go until we see urine. Okay, we see urine. Now we are going to go 1 inch further into the bladder. Great. Now at this point, this fell off. This would not be off. Okay. Now at this point, with my non-sterile hand, I'm going to start inflating the balloon. Feeling okay? I know it's a little uncomfortable, but it shouldn't be painful. Okay, we have inserted the correct amount that was needed from the kit. Now again, this is our non-sterile hand. We remove this. We have our urine. It's starting to flow into our bag. We have our attachment set up here where we're going to put our port on the leg of the patient. It's going to set right there. We are going to put our catheter bag onto the side of the bed, not on the rail, but actually on the bed frame, ensuring it's safe. We are going to, we don't have a bed rail here. Okay, and we also don't have an attachment. We're going to take this off, remove this from the patient. All right, put his leg down. Again, that would have been attached right here, right to the leg. Gonna put his blanket, her blanket down. All right, and if you're feeling all right, the patient feels okay. She tolerated the procedure well. At this point, I am going to measure the intake and outtake. I am going to document that. I am also going to document the time and date of the procedure, how the patient tolerated the procedure, the tools I used, the type of French, how far I inserted it. No, not that. That's for something else. But I am going to document the French, and then we're good to go. Our patient now has his indwelling catheter.